So it was a normal Thursday afternoon in my practice. We were winding down. There was a name still left on my schedule that I was looking forward to seeing, and that was Darlene. Darlene had a special place in my heart. A couple years ago when my dad had a heart attack and I had to miss a couple of weeks of work, I was able to confide in her, and she would always ask how my dad was doing, how his recovery was. So I always had this connection with Darlene. And so I was looking forward to this appointment. It was a limited, which usually means somebody with a denture needs an adjustment or to talk about some issues they've been having with their denture. But something was different about Darlene that day. You know, when I walked into the operatory and saw her sitting there, she wasn't the happy, cheerful, how's your dad type attitude I was used to seeing. Today it was different. Today I can tell she was full of sadness. And so I sat down and I looked at Darlene and I said, Darlene, what's going on? And she says, Doc, I just can't do it anymore. Like, I'm so tired and frustrated with this lower denture. Like, I just don't know what to do about it. You know, Darlene had come to a place where she felt she needed to get all of her lower teeth pulled. We had decided together that the cost to keep them and the longevity of them just wasn't there, that it made more sense to pull her bottom teeth. So Darlene had just gone through 4 months of experiencing what most denture patients experience, which is frustration having their denture move, having it hurt when they eat, or worse, falling out when they're trying to eat or when they're trying to talk to individuals or socialize. And she asked me a question that changed my thought process and my behavior sense. She says, Doc, what can you do for me? And up until that point, I had gotten really good at making dentures and pulling teeth and doing all aspects of general dentistry. But the one thing that I was lacking as a dentist was the ability to place multiple implants and connect a permanent set of teeth for her. Like, up until that point, I hadn't taken the continuing education, investing in the technology, the skill set to be able to do that. And so the best response that I had for her and all my denture patients up to that point was, well, we can make more adjustments or do a reline, or worst case, remake the denture. But in your case, Darlene, I don't think that's gonna help at all. You don't have a lot of bone. There's nothing really to anchor this set of teeth on. So I was left not being able to help. And it was in that moment I realized that, yes, I had done my best dentistry up until that point. And yes, I wanted to serve and help people overcome these difficult health challenges involving their mouth. I didn't have a good solution for patients who were suffering with dentures or that would need to step into a denture after getting their teeth pulled, to having a permanent solution that would impact their ability to enjoy life. And the part that really stuck out to me, that made me the most sad, that moved me to make this decision, was that she said, Doc, my daughter has told me that she's noticed a difference in me, that I'm depressed, that I don't go out to eat with them, that I don't enjoy being around them because I always have to go to the bathroom and add more glue just to keep them in. When she told me that the people around her were noticing the difference inside of her in a negative way, it really struck my heart. And I knew at that moment I had to go to task. I had to figure out what I could do to help her. And so I did. I invested thousands and thousands of dollars in continuing education, traveling across the country, lecture after lecture, hands-on experiences to learn the techniques that would be required to deliver this type of care for my patients. The type of care that pulling all their teeth and giving them a denture really just limited their function, debilitated them. That this new course and this new way of providing patient care to individuals in that need would change the trajectory of who I was treating and why I was treating. And so through that process, I realized that there was a traditional way of doing this type of work that left you in a converted denture where they screw holes into a regular denture and let you heal for 4 months, that there was a path and a process that allowed this to be easier and faster and more efficient. That using the technology available today, I can scan those implants after they're placed and have a product a set of teeth that you can eat with confidence without falling out, that are permanently screwed into these implants in just 2 weeks. Like, that was possible. And so as I decided to move into that way of treating patients and investing into that education and that technology, I can now have an answer for my patients like Darlene when they ask, "Doc, what can you do for me?" Now I have a solution that's possible for them.